everyone can clearly hear the presenters and hopefully avoid any technical difficulties, which we know is mostly true. We're going to ask you to mute yourself, and we will be muting everybody but the presenter. You can mute yourself by pressing *# or the mute feature on your desk phone or mobile device. If you have any questions or comments, we ask that you please share them in the Q&A pod, which will show up in the lower left-hand corner. And David will help field those questions for LeAnn. And again, we'll share the recording and the closed captioning transcript along with LeAnn's presentation after the webinar. And if you want to download LeAnn's presentation right away, that'll be available at the end of the webinar in the file pod, again in the lower left-hand corner on the closing page. And again, thanks for joining us, and I'll hand it over to David to do introductions.
Thank you, Jessica. Good afternoon, everybody. I'm smiling as Jessica went through her preamble there and talked about avoiding technical difficulties. In good shape here for today. We're kind of, as most of you know, we're sponsoring these webinars through some technical assistance hours that have been provided through the Office of Disability and Employment Policy with the Department of Labor for an Employment First grant to Iowa. We're taking some dollars through the Iowa Coalition for Integrated Employment. And these webinars were in the final stages of this year. Kind of a preview of what's to come. July and August, we have 2 sessions on transition and working with our youth in Iowa. July, Rick Haas will be speaking, and he'll be sponsored through the Iowa Coalition of Integrated Employment, talking a little bit more about the national perspective of employment and working in transition and with youth with disabilities. And then in August, we'll be hearing from our Iowa team, a representative from the Department of Education, one of our community providers, and VR staff will be talking about their partnership and kind of providing some examples of how they've put some strategies into practice. And then in September, we're excited about putting some final touches on some promising practices of what we'll have some presenters talking about what they've done in implementation and trying to learn from them. So before we get to all of that good stuff, we have some good stuff today. LeAnn Moskowitz, who's one of our Medicaid state employees here in Iowa, has been a key leader on our Employment First team and has been working the last several years in a couple of different efforts with our Vision Quest efforts to better align policies and procedures and rule definitions. And they're working on a definition handbook for employment that will be made available later this year with our case managers and providers. So some good stuff's happening, and she's doing a follow-up from last month when Rachel Pollack talked about pre-vocational services. So, you know, what we've tried to do is look at how state systems can be more responsive and effective in the delivery of services. And with that, we also want to talk about how we can make sure we're creatively and innovatively using the system as it is to make it work for you and your job candidates. And LeAnn will be able to talk about some of those ideas and help us continue to be able to move forward. So we appreciate LeAnn's willingness to share some of her expertise with us today. And LeAnn, we'll turn it over to you.
Thank you, Dave. Thanks, everybody, for tuning in today. I appreciate it. It's kind of exciting to get to do the part of my job that I really like, and that's talking about employment and increasing opportunities for people with disabilities that we serve within our waivers. So this is a really exciting time right now at Medicaid. It's a scary time right now at Medicaid, and we're all just need the tools and information that we can get our hands on in order to keep moving forward and delivering great services to folks. So today I'm here to talk about pre-vocational services and hopefully either reinforce ideas that you already have about how pre-voc can be delivered in the community, or to maybe spark some new ideas about how you could deliver your pre-vocational services in a community-based setting for folks, to give you the opportunity to think about traditional service in a little bit of a different way, especially as we move forward and recognizing the HCBS setting requirements applying to employment and day programs such as pre-vocational services, and that services need to be providing members with an integrated community-based experience and giving them a real informed choice when it comes to employment opportunities in their lives. So with that being said, I'm here to talk about pre-voc. So what are pre-voc services? Pre-voc services are intended to prepare clients for community or self-employment. CMS has told us that pre-vocational services are not sheltered workshop services or those services that we traditionally think about where people are primarily there for the purpose of production of goods or services. They are expected to occur over a defined period of time with specific outcomes to be achieved. For many years, we have told folks attending pre-vocational services that that is their job, rather than it really serving the intended purpose of preparing people to move to community employment, giving them the tools that they need in their toolbox to be able to obtain and maintain employment. So it's intended to teach the general skills that someone would need to enter the job workforce or to maintain a position within the workforce. So it's not how to do the job, it's how do I do those things that would be required to help me find a job, a resume, how I dress, my appearance, my conduct with my peers, with my supervisors, those types of things. So with that in mind, the CMS requirements are that pre-vocational services be time limited, of course. They've provided us 3 criteria to differentiate pre-vocational services from vocational services, and of course, as a reminder, vocational type services are not eligible for reimbursement under the waiver. And so the differentiation would be that compensation for work is paid at less than 50% of the minimum wage. And again, these are not a eliminating factor per se. It's a criteria to differentiate the type of service. Compensation is paid at less than 50% of the minimum wage. It's provided to persons who are not expected to join the general workforce or participate in a transitional sheltered workshop with 1 year of service initiation. So these are folks who require services and supports in order to be able to enter the workforce. Includes activities that, again, are not primarily directed at teaching a job-specific skill, but more at teaching the habilitative goals of what it takes to find and keep a job. Attention span, motor skills, paying attention to your schedule, those types of things. These are all located in the Code of Federal Regulations at 40 FR 440 subparent 180 if you'd like to take a look at those for yourself. So how are they different? Pre-vocational versus when we're thinking about non-integrated work services in the future, when we're looking at our settings and how we can comply with what CMS expects of where services are going to be delivered. And some of the difference are that pre-vocational services should be preparing the person for community employment versus a non-integrated work service where the service may last indefinitely. The person's never, quote-unquote, ready for employment. Pre-vocational services are to teach the general skills necessary to obtain and maintain the community employment, whereas the integrated work service may teach a specific skill required to perform steps associated with a specific job or task or the production of a specific good or service. For pre-voc, the goals are not specific to the job. For the non-integrated, you may see goals around productivity. You know, they'll assemble 5 products today, and, you know, by the end of the month, they'll be able to assemble 10 products. Pre-vocational services, again, is not for production of goods and services, and compensation is generally less than 50% of the minimum wage. So those are just some ways that we can help identify the differences between what might be considered a pre-vocational service versus a non-integrated work setting. The experts from the core service definitions, and these, of course, are located in the January 2015 HCB instructions, technical guide and review criteria. And so this is the technical guidance that CMS provides to states for their 1915C home and community-based services waivers. So this is the guidance that we must follow when developing our service definitions, our scope of services, provider qualifications, rates, those types of things that you would typically see in our administrative rules. So this is the core service from the core service definition for pre-vocational services. Also, so they provided some additional guidance about the difference between vocational and pre-vocational, and that pre-vocational, regardless of the setting, are delivered for the purpose of furthering those habilitation goals that will lead to greater opportunities in integrated employment, career advancement at or above minimum wage. And so again, it's not a specific job, it's those maybe soft skills or personal skills, behavioral type skills that people would need to develop in order to be successful in the job market. Individuals participating in pre-voc may be compensated. I get that question a lot. Yes, they may be compensated within the applicable federal laws, and so you're all aware of the new WIOA Act that does require you know, individuals to be given employment experiences before they go into a pre-vocational type setting. There's new laws around when people can be paid the sub-minimum wage under the 14C certificates under the Department of Labor, and so it's real important that providers who are delivering pre-vocational services and do you know, produce goods or services during the course of teaching skills in pre-vocational services, that they pay real close attention to those requirements for time studies, reporting, data collection, and those types of things. Another reminder, you know, pre-vocational services should always be delivered with the intention of leading to permanent integrated employment at or above minimum wage in the community. That should always be our focus when somebody is receiving that pre-vocational service. So is pre-vocational service the right service? If the client wants to work in the community and pre-vocational services are determined necessary to assist the person to enter the general workforce, then yes, pre-vocational services are the right service for the person. So pre-vocational and services of Iowa, of course, start with a comprehensive functional assessment, which indicates that the member needs supports to obtain or maintain employment. The comprehensive service plan that is developed by the person and their interdisciplinary team with the case manager plan identifies the pre-vocational service needs and what the member's plan for employment is. The waiver prior authorization process then ensures that the service being requested is appropriate based on that assessed need, based on the employment goals identified for the member in the service plan. And then, of course, we review that pre-vocational service annually and then also as reviews are necessary. So, again, we should always be asking what's next, what's next, what's next for that person. And, of course, they must have the goals to obtain community employment. And then, as appropriate for people, We also would expect to see referral to the IVRS for services and supports that are provided through them. And if you haven't received a copy of it, there is a resource sharing guide that has been developed that indicates how employment services are paid for those members that IVRS and the HCBS waivers have in common. And I believe that is available on the IVRS website, and it's also available on the MHDS employment website. And I believe both of those links are at the end of this presentation. So moving on, so pre-vocational goals. They need to focus on the general strengths and skills that aren't specific to a job or task and that contribute to the ability of the person to be employed. How to communicate, how to behave in the workplace, how to follow directions, attend to task, I finish what I start, workplace problem-solving skills, general workplace safety. So also to determine through the community experience whether an individual wants to pursue integrated employment. Again, pre-vocational services should always be geared towards, we know we're moving towards employment, and we're answering or asking that question about what do I want to do for employment, and trying to develop ideas around what would be a good job match, what are the person's skills, desires, goals. So we want to continue to make reasonable and continued progress towards achievement of an integrated employment outcome in the person's plan and engage in activities that will contribute to their success in securing and keeping an integrated job. To contribute to their ability to maintain integrated employment, to serve as a wraparound support service as well. And that's one thing that pre-vocational services also serves, is to provide that wraparound support when the person isn't working in an integrated employment. And however, with that in mind, they do still need to demonstrate that need for service. There are still skills that we continue to work on that are not job specific, even though the person may be working a job in the community for 8, 15, 16 hours a week, whatever. They still have some non-job specific skills that they can continue to work towards mastery on. So some community-based pre-vocational activities may include employability skills training, such as making good impressions, listening, personal care, interacting with your coworkers, identifying skills, and self-esteem. You know, how confident the person is. You might do practice interviews, that type of thing. Job exploration. Let's go out there and see what's in our local community job market. Let's see who's hiring. Let's take a look-see at some other jobs out in the community. Department of Voc Rehab assistance or IVRS assistance. Application assistance. You know, certainly people could fill out applications during pre-voc, you know, and then move on to supported employment if they actually got a job to get that job support. So resume, cover letter assistance, computer skill training. You might bring in guest speakers to talk to folks about different jobs, different careers, and you know, the skills and education and such that it may take to do that type of thing. You might bring in employers to talk about unmet needs and maybe exploring ways that perhaps individuals could meet those needs through employment. You might bring in people who have gone through pre-vocational services and supported employment services, or maybe through IVRS services, to come and speak to folks and talk about what it means to them to be you know, employed in an integrated community setting. There's lots of success stories out there, and lots of people like to talk about their experiences and the success and the pride that they feel with the employment that they've been able to achieve. And that really goes a long way to encouraging other folks to think about employment for themselves. Touring employers, job shadowing, going out and watching other folks work to see how it's done, get an idea of what that might mean for them. Informational interviews, again, it's all about trying to get that career exploration and find out, yeah, this is something I might be interested in doing for a living. Job tryouts. Maybe we go out and we give something a try for a day and see if I like it. Job retention skills. Volunteering can be a great springboard to employment for folks. They develop relationships, they meet people. That can be a gateway to other employment opportunities in the community. So it's a great way to give people an employment experience through that pre-vocational service. And those are just some ideas, some things that other folks out there are doing in their community-based pre-vocational services that, maybe you haven't considered before. I apologize for how tiny this is. We can also make this available in just a regular old 8x11 sheet. But what this is if you don't have employment services in your waiver, and the only programs that do are the brain injury waiver, the intellectual disability waiver, and the state plan HCBS habilitation program. If you're not in one of those programs and you still need employment supports, you can often get some of those needs met through other traditional waiver services by utilizing the Consumer Choices option. And what the Consumer Choices option allows waiver members to do is to take traditional services and convert them to a monthly budget to purchase goods and services that aren't otherwise available to them through the waiver. And so for an example, we've got some examples here, such as assistive devices. So if you have assistive devices in your program, you might be able to use that to purchase devices that aren't covered by an employer that can help you do a job. Consumer-directed attendant care, members who need personal care services, and that is a barrier for them to achieve employment, is that they can utilize the consumer-directed attendant care in order to receive that personal care assistance on the job from a CDAC worker. And that way, the employer doesn't have to worry about that. The member knows they have somebody there to help them meet their needs, and the employer can be confident about the member's ability to do the job and still get their personal needs met. Dehabilitation is very similar to supported community living and can also provide opportunities for employment to develop ideas. You can do volunteering as a way of giving members, again, experiences in the community that may lead to employment interest and perhaps even employment relationships. Again, pre-vocational services, we've talked about that. If there isn't a pre-vocational service provider in the community, those could be converted under CCO to hire somebody to work with someone to do those type of career exploration, general skill building type of activities. Respite and basic individual respite. It sounds, how could you do employment with that? But if a respite provider is giving a parent or a guardian a break, and the parent or guardian requests it, that respite provider could take the member out to pick up job applications or to go out to the local mall and see who's hiring this summer. That's as long as the parent or guardian who's receiving the respite requests that is something that could be done under respite. Specialized medical equipment. Again, that service could be used to provide specialized medical equipment that's not typically paid for by Medicaid that the member could benefit from using on the job, and that isn't required to be provided by an employer through the ADA. supported community living services. That service can be utilized to transport members to and from work and, to and from opportunities in the community as well to, again, get that community experience, see what's out there, talk about different opportunities that may be available. Also, direct care staff are a great way to build those relationships, in the community and help build those bridges for people. A lot of direct care staff parents own businesses or have family who own businesses and things like that. And there's been a lot of opportunity in my past to help connect people with jobs just by the employees that work for the agency and their connections and their relationships that they have. Again, transportation, very important. It's critical service to folks to help them get to and from work. So we'll make that available to you all through the website. For resources, I did provide the Consumer Choices option homepage. Again, Consumer Choices option gives people the opportunity to take traditional waiver services and convert those to a monthly budget in order to purchase goods or services to meet identified needs. So the same comprehensive functional assessment process occurs, identifying the needs. The same service planning process occurs, documenting those needs in the service plan, and then the identified number of units are placed in the service plan, and then those get converted to a monthly budget that the member then uses to meet their needs. More information, there's the website. For more information on employment opportunities and to see some success stories for folks who have used HCBS supports to meet their needs, you can visit the MHDS employment homepage. There's a lot of great stories out there. IVRS also has a lot of great success stories about people utilizing employment supports to obtain employment and how they've been able to be successful. If you want to look at the home and community-based service waiver application and technical guidance, it's like basically anything you wanted to know about the waiver from CMS perspective. You can visit the waiver portal website there that I've provided at the bottom of the page, and if you go to the left-hand side of the page for the web portal, you'll find the technical guidance and other application materials there that you can have access to. The SAMHSA toolkit for supported employment as an evidence-based practice. Visit that website. It's a great tool for planning around employment. Give employers ideas, providers ideas about how to support folks. Again, IVRS's website, there's a lot of great tools out there, a lot of great information. There's customized employment strategies. There's all types of tools, and I highly recommend if you haven't been out there, go out there. A lot of different training opportunities that are made available, as well as webinars, past webinars, and it's just a wealth of information. ODEP, Employment First Initiative, I recommend you go out and look at their website too. They have a lot of great tools, again, on customized employment, Employment First, strategies to help folks who were once thought to be unemployable to actually gain and maintain employment in the community. And then the State Employment Leadership Network. Iowa has been very fortunate to be part of the State Employment Leadership Network for a number of years now, and we have really benefited from their knowledge and expertise and the experiences that they have working with other states who have also tried to advance or transform their employment services. There's a lot of great material out there, a lot of research around employment. So I recommend giving that a visit as well. Questions? I left you a half an hour.
Hey, LeAnn, this is Dave, and you had talked a little bit about wraparound services and respite. And as you were talking about that, it struck me that you mentioned a couple of things that I had not thought about. So can you talk a little bit about, as service providers are out there working with their job candidates, and the importance of the team collaboration and working with their case managers to kind of bring up some of these questions and to do some problem solving? Because it's complicated enough that no one person knows all of this. So could you talk a little bit about the importance of that team dialogue, and what would you do if you weren't getting answers to questions that you thought you should be getting, and how do you work with that out in the field? What problem solving could you suggest to people?
Absolutely. Well, I think the first thing starts with the case manager. And so when it comes to Medicaid-funded services, the case manager is sort of the first point person when it comes to coordination of care for any waiver member receiving pre-voc or employment services. And so it's important to, get in touch with that case manager if there's some difficulties or if there's some questions about services or how services are being delivered or how they should be delivered. Start with the case manager, and then, of course, the interdisciplinary team, that is the purpose of the team, so that everyone who is working with that member is at the table at the same time working towards the best interests of that person, with that person being the center focus. And so, of course, that's the member's guardian if they have one, or other legal representative if they have one, the case manager, of course, and then any service provider that is working with the member, may it be the pre-vocational service provider, supported employment, supported community living, and if they are if they've applied to IVRS, or if they have an open case with IVRS, of course, that IVRS counselor should also be at the table. And then if the person is also a student in the school system, ideally you have someone from the school representative. That's typically wouldn't happen, but you at least have a copy of that IEP there during the interdisciplinary team meeting for service planning that you can reference to ensure that if there are employment goals established at the school, that the waiver can complement those employment goals, so that the member is getting a consistent employment skill development experience from the schools, as well as from the employment or pre-vocational service provider if there is one. So again, the whole team should be at the table. It's really important because, if something's going wrong at home in the residential service, it can often bleed into the member's work or the member's ability to or desire for employment. And so it's important that everyone be able to communicate and be on the same page about what the goals are and what each of our roles are in supporting the member in those goals. If it's the residential provider's responsibility to provide that member that ride to and from work, then it would behoove them to ensure the member gets there on time and is there when the job coach is there, or when the employer is expecting them there. Again, it's communication so that people know what their role is and what they're supposed to be doing to support folks. And sometimes things go wrong, go off track. That doesn't mean you have to have a great big meeting and pull everybody together. Sometimes a simple phone call between the member and their team members or emails can, resolve an issue. But often when things arise to where it comes to my attention or LeAnn Russo's over at IVRS's attention, is because folks weren't talking to each other. And so I think you know, everyone's scared about the Medicaid audit, about the recoupment, that type of thing. And a lot of that fear can be abated if folks just sit down and talk about their ideas and what they want to do. Every provider is connected to an HCBS specialist. There's an HCBS specialist for each region, and so it would be important that if questions come up about how services can be delivered or what would this look like when it comes to billing, I'm not sure, that HCBS specialist should be tapped as that resource. And then, of course, if the HCBS specialist is unable to answer that question or aren't sure, then, of course, they come to the program manager, such as myself, in order to get clarification from policy on whatever the question may be. But again, communication is key to ensuring a person's success. Hope that answers the question.
Excellent. LeAnn, we've had a couple of questions come in, but could you maybe provide a specific example of what a community-based pre-vocational service would look like and how the funding would work, and maybe provide an example or talk a little bit about some of the questions that you get. But what does it really look like from a service provider's perspective of what service and how would the funding work?
Right. Well, right now there are, you know, under the pre-vocational service, there is the two funding codes. There is the hourly funding code, and then there is the daily funding code. And so depending on what the member is authorized for based on their participation in pre-voc, the community-based pre-voc services would occur under those same billing units. So I could certainly see a provider having folks show up to work or show up to the pre-vocational setting and may work on some goals for, an hour or two, maybe attention to task. And of course, they may be working on some production activity, but it's tied to I'm, starting the task I finish, I'm completing a certain number of step tasks. It's related to non-specific task skills, job skills. And so may do that for a couple hours and then may have a staff or a vocational specialist take 2 or 3 people out in the community and go and volunteer somewhere. And, maybe we volunteer a couple hours a day, 3 to 5 days a week as part of our pre-vocational services. Provider would be billing under either that hourly billing unit or that daily billing unit, again, depending on what's authorized for the member. And so again, it's people don't just come and spend their time all in one place. People come, check in, I may spend some time here on skills, but then I'm going out and doing other things that are going to help advance my employment goals. And so the team, the interdisciplinary team, during the planning meeting when the service plan is being developed, should be talking about what is my what are my pre-vocational services going to look like for me? What is my day in pre-voc going to look like? Again, services are much more individualized today than they ever have been, and they'll be much more individualized in the future than they ever have been. And that's the expectation of CMS. That's the expectation of this department, is that services are outcome driven and are purposeful and meaningful and lead to the next best thing for folks. So hopefully that was a good example.
So LeAnn, as providers are working in transformation efforts, and you have individuals that are expressing interest in moving from segregated settings to more integrated settings, and they begin asking that question, what does my day look like, and what does my pre-vocational activities look like as I prepare for that transition? I think what I'm hearing you say is the pre-vocational funding and the strategies you're suggesting are a really good stepping stone to bridge that gap to help people, begin looking at what are the efforts they need to be successful out there. So as you're asking that question with team members about what does it look like and how do we utilize pre-vocational activities to start building these bridges, that really could be a foundation as we move forward.
Absolutely. Absolutely. In the future, we'd like to see as a formal service under pre-vocational service as career exploration, and many of the activities that I talked about as community-based pre-vocational activities do fall under the career exploration activity. And so I think that, again, it's with the intent that we're always asking the question of what do you want to do for work, and how do we help you get there?
Yeah, and this kind of fits into another question that was asked is, how does the information that you're sharing, how does other entities, other case managers, care coordinators, educators, team members, because as we're out there in our, some of our silos and isolated pockets out there in the state, not everyone has the same approach. So how do we keep this thing moving forward? And I think one of my responses would be, as we do these community of practices, one of our efforts is to get out some of this information so people hear it. And as you're sharing this with your team members, people may have some different interpretations, and that's why it's important to bring the team together and ask the questions and have some resources to get at better information. But how would you respond? Not everybody has the same approach, and as you're working in those local teams, you hear different comments. How do we move the system forward to innovatively use some of the system resources to help people get jobs?
Wow, that's a tough one. It's kind of like, we have 99 counties and 99 different ways of doing things in different places. So it's tough to get all the information out to all the people all of the time. I think, people tuning into community practice is a great way to get the information out. We make the information available through the website, through our manuals. We try to share it far and wide with as many stakeholders as possible so that it gets passed on and shared. We are spending a lot of time developing an employment guidebook for case managers and integrated health home coordinators to provide them with a tool that will help change the culture and the thinking around employment opportunities for people with disabilities. And we do recognize that often it may be the care coordinator that may be presenting the psychological barrier to embracing the employment idea. And so our hope is that by providing them with education and tools, that they will be able to see that people with disabilities can work and they deserve the opportunity to work, and that we as stewards of federal and state dollars, as well as those here to try and help people achieve their goals, that should be our opportunity to do what we can to put the services and supports in place to help people achieve their goals. After all, that home and community-based services are intended to help people live as independently as possible in the, most integrated community-based settings. So ultimately, our goal should always be to focus on how do we get the member to a position of independence, and that's independent of human assistance as well as, financially independent by being able to earn an income and contribute.
Yeah, I think that question really hit a number of different topics and struggles that we all have. And I think it's everyone's responsibility to have some ownership of, how we move forward with the employment journey. I think as state systems, you can argue whether we've been effective or not, but I think the intent of the Employment First leadership team and the Iowa, how to get consistent information out to the providers and out to the field so that we can help solve some of these employment issues. So I think the intent has been to try to get this messaging out so we can get some consistency and standardization. And obviously we still have a lot of work to do, but I think the system looks a little differently today than it looked several years ago, and it's because of the work that you're doing and the work that's being put together with the employment definitions and the guidebooks and that effort to disseminate information in the right way. Hey, one of the other questions that came in, I think is referencing a little bit of the work that the work groups had done, and the question was, how does your presentation reflect current service descriptions or some of the revisions that were proposed a couple of years ago through some of the work group discussions?
The current service definitions reflect what is currently in the waiver applications with CMS. When we submitted the ID waiver renewal last summer and then the brain injury waiver renewal last fall, and the habilitation amendment in the spring of 2014, CMS required us to fully adopt the core service definitions for pre-vocational services and supported employment services and day habilitation that were provided in that 2011 employment service and day programming guidance that CMS issued. You will see that same guidance language in the updated 2015 1915C waiver technical guidance. And so we had to adopt those service definitions. What we have not been able to do is to fully adopt the scope and the implementation pieces that were identified by the work group, as well as the reimbursement structure. And so we still hope to be able to implement those rules. For those of you who have been paying attention to the Health and Human Services appropriation, there is money in the Appropriation Senate File 505 in the Conference Committee fiscal report to increase supported employment rates for the purposes of being able to forward the supported employment processes, and so we're hoping that we'll be able to get those rules out to stakeholders and noticed if we're able to move forward, if the governor leaves that money in the budget. So we're waiting to see the signed Senate File 505 to see how the governor responds, and we think that that money is there so that we can move ahead with this project. But again, we're waiting to see what the governor does. So hopefully that answers your question. Our goal would be to get anything implemented before the managed care organizations come into play on January 1st.
Thanks, LeAnn. Hey, you had mentioned this, and I don't know that a lot of people will know the work that's going on. So could you expand a little bit on the employment guidebook and what you're working on, and share a little bit about the work group and what you've been doing to get to that point? Because I think one of the purposes of that effort has been to get out information on a more consistent basis to get people on the same page. So it might be interesting for the audience to hear a little bit about the effort that is going into that. So could you expand a little bit on that?
Sure. As part of the Employment First State Leadership Mentor Program, the Office of Disability Employment Programs has what they call Vision Quest. And as part of that Vision Quest, states work with subject matter experts in identified topic areas that will help to continue moving their state forward in employment service redesign. Well, we had hoped to use our SME hours this year to implement our employment service redesign. However, there's been a delay in that, and so we decided, well, what would be the best use of our time? And we had been hearing for quite a while from integrated health home care coordinators and case managers during forums that were hosted by IC and eFirst and at APSE conferences and different places, that they're just, going back to what that previous person talked about, the inconsistency across the state. And it was interesting when we brought case managers and integrated health home coordinators together and said, tell us about your expectations around employment within your agency, and they were all over the board. Some said we never talk about it, to some it's the first thing we talk about, and so we went, wow, well, that's what we expected, but still, wow. So we asked them, well, what do you have, and what is working, and what do you need from us as your state partners to help you really think about employment and do really good service planning around employment and really leverage all of the funding resources that might be available to somebody. And they talked about the tools that they needed and decision-making documents, but didn't want something that was too burdensome or, just a bunch of, wordy bureaucrat speak. And so what we're developing is an employment guidebook that'll be primarily geared towards the case managers and the integrated health homes around service planning, and it'll be a tool to help them to approach service planning with employment in the community being the preferred option during planning, and how they can support the member and the families that to think about employment and to think about what employment could look like for a person, and to get that conversation started. And it can be quite challenging because families often are fearful, and we've developed tools to how do you address those fears when they come up in a planning meeting. How do you walk through, is pre-vocational services the right service for me? And to provide those hands-on, tangible, easy-to-use decision trees, checklist type of things that a service coordinator or a care coordinator, case manager could use during an interdisciplinary team meeting for someone to really get at employment and really develop some meaningful goals and a meaningful employment plan for a person, so that people will be able to get the most out of services being authorized. So we're excited about this tool. We have been very conscientious in what we've done to develop. We've asked for a lot of feedback from the case managers, integrated health home coordinators. We're going to vet the tool through those same group of folks again once we have a what we think to be a final product, and then we hope to have it out for publication general use towards the end of September when this year's grant year ends. Just because we're developing it with the case managers and integrated health home coordinators in mind, I think it's going to be a wonderful tool that will be easily adapted by the providers to help them in their own planning processes when it comes to developing that employment service plan for somebody. I also think it's going to be a nice resource for parents, guardians, other loved ones who are thinking about employment and maybe fearful of employment, and give them ways to think about it a little bit differently and some strategies on how to approach employment. So we're excited about it. I think it's going to be a great tool, and I think it's been a great use of our state staff time, as well as subject matters and the other folks who have been helping us develop the tool. So look forward
to it. It sounds like it's been a very collaborative process where you're trying to integrate information from a variety of sources, as well as sharing information about what's needed to move community employment forward. So thank you for taking a little time to expand on that. We had a question too about the 505 legislation and what if there could be potential considerations in that legislation that might conflict with the proposed rules. I don't know if you're able to answer that or not, but
no, we do not feel that. The legislation is very simple. It's a line item appropriation for supported employment rates, and so no, I don't believe that it would conflict with the rules or the proposed reimbursement methodology.
Great, thank you. Hey, I'm going to turn it over to Jess for some final comments here, but we will be able to provide all of the information and the PowerPoint presentation to our participants, and there will be a HCBS specialist regional map that we'll have available that we can send out. So you'll, everybody participating today will be able to get access to that, and you'll be able to find some contact information for some of the players in your local areas. LeAnn, thank you so much for sharing your time with us and responding so well to the questions and the information today. It's a good topic, and it fits very well into our efforts about focusing on how we can help Iowans with the most significant disabilities access community integrated employment. So thank you. I'll turn it over to Jess for some final comments.
Thank you. It's been a pleasure.
Thank you. Thanks, LeAnn. Thanks, Dave. As Dave said, we'll make sure the presentation, as long as some of the reference materials, be made available to everybody. We'll send them out as attachments in the email, and LeAnn can help me collect some of those that I don't have. But we'll definitely share the DHS and IVRS resource sharing guide. LeAnn can help me with that CCO kind of packet that you had earlier on in the presentation. And we can get a current or up-to-date HCBS specialist map. I know I have one, but I don't know how current it is. But we'll get that shared and out to you guys probably before the week is over, along with the recording and closed captioning transcript. Kathy has been so kind as to open up the polls, so please let us know what you thought of today's webinar and any suggestions for future presentations. We'd really appreciate it. And our chat box is back where you're able to share your name and agency and location. So we'd appreciate if you'd let us know that you're there or if you're calling in as a group. We'd love to see all the names appear on there. And we will be back in July, as Dave said, on July 28th with Rick Haas, where we'll do the first of a two-part series on school to work. And Rick will kind of give us that national perspective and some of his experiences working 20-plus years in Berkshire County. And that'll be followed up by our Iowa folks in August. So we hope to see you back in July, and we'll get everything out to you as soon as we can, and we'll leave the room open for a couple minutes so you can respond and download what you need to. Thanks again for joining us. We'll talk to you soon.